Hello, everyone from the world. This is the 4 p.m. in the afternoon in Taiwan. I'm glad to join this webinar. I'm Dr. Xu from Taiwan. In this COVID-19 pandemic virus infection period, I hope you all stay safe and keep health. Today, I will share my brief experience about the Tixel in Asia patient. I'm working in a private practice in a dermatology clinic with 5 other dermatologists in the new Taipei city. Hope everyone has a chance to join us. I have a lot of laser machine. The most popular machine in Taiwan now is the picosecond laser. It's due to the photomechanical effect. But why we use the pure heat, the Tixel, to treat our patient? I will show you my experience. This is today's outline. First, I will introduce the thermomechanical operation, TMA technology. Second is my clinical experience and about the Tixel assisted drug delivery. The fourth is the combination therapy. First of all, we see this patient. I met her yesterday. We look at, he have a very deep infraorbital halo at the wrinkle. I inject 2 cc of the dilute collagen. We can see the infraorbital haloing tear through is filled without tyndale effect. However, how about this wrinkle just beneath the infraorbital orbit? Can we do the filler? If we do the injection too superficial, it will become a small papule, small nodule. Can we do the laser? Sure. However, the patient have to wear the metal eye goggle. It's not discomfort. So the wrinkle around the eye is actually best for the Tixel therapy. It's better than the injection, better than the laser, better than the mono frequency or radio frequency. So what is the Asian skin type different from the Caucasian? The Asian has more melanin and melanocyte. So we have a higher chance to gather PIH. Our melanocyte is more active. So if the energy device machine is very high energy, we have more incident to gather PIH. And the photo damage to the Asian skin is preferred to the dyspigmentation rather than wrinkling. The adverse pigmentation reaction follow the laser, including the erythema, blister, hypopigmentation, and the PIH. So I will give a short introduction about this novel technology. This we call the thermomechanical system for the fraction operation. We can see this titanic square surface about 1 + 1 centimeter has the 18-1 pyramid protrusion. Other energy device need the chromophone or need central media to transfer to the heat, including the laser, radio frequency, HIFU, and plasma. Why we don't give the pure head to our tissue? We can get the advantage to give the little energy to get the same result. So this mechanism is the direct heat transfer by the conduction. There is a gold plate couple base on the base and 18-1 pyramid. And this is a titanium alloy shell, which is biocompatible. The protrusion, the unit is we call the micrometer from the plastic shell. We can contact the plastic shell on the skin surface, and the protrusion will like linear motion. The tip design is higher thermal conductibility, covered by a thin titanium alloy shell. Its energy source from the small electric stirring heater. The temperature on the base is 400 temperature Celsius. there is no any radiation. So we don't have the smoke, we don't need to have the suction like we perform the laser. When we use the Tixel, there's no corrosion and easy to clean and durable at a high temperature, which have an auto-sterile procedure, sterile during the treatment, and no need for the tip replacement. And which parameter will interfere the heat transfer? The direct heat transfer without secondary effect. There are two parameters. One is the pulse duration we can control on the device. Another is the thermal resistance between the skin and the tip. So what is the thermal resistance? In area like the cheek or soft area, like, there's some have air bubble. If there's much air bubble, there's more thermal resistance. So on the cheek, we need a higher protrusion to reduce the air gap between the thermal matching. And we can see this, the tip is actually the brown tip. It's not a very sharp. So when we control the machine, like the push the skin, so the tip will not penetrate the skin. So after the procedure, there is no bleeding, and it's totally clean, very clean procedure, and no light. So we don't use to wear the eye goggle or eye protection. We can treatment area very connect to the nearby the eye, about 1 millimeter. And the most higher temperature is on the base, 400 Celsius temperature. The tip is about 393 degrees. And so the most heat effect is on the very superficial area. When we down to the epidermis about 100 micrometer, there's only 50 Celsius degree. So this is very important. Why? Because our nociceptor, we will feel about the pain is around 50 micrometer. So we see closely about the tip. It's a brown apex. When we proceed, the procedure is like a stamping. The tip will not mechanically puncture to the tissue. So this effect is like a fractional CO2 laser. It's a very regular distance. The point around the 100 to 400 microns. So this is important. Why? Some material like the PLA is about 40 to 60 micron. So if we use this Tixel, we certainly can give the drug delivery like the PLA. And this is an important slide. We can control our protrusion depth and path duration. So we can have the two settings, a very high setting and a low setting. Very high setting, we can treat the rejuvenation. We will have more coagulation load. The coagulation load is like a hemisphere. It's an inverse triangle. So let's have a better effect to treat the deep wrinkle. And the low setting, like 6 milliseconds and 4 micrometer. This is a low setting. It's very suitable for the drug delivery because there's no obvious abrasion and no very large coagulation. So the drug, due to the pressure gradient, the substance will diffusion to the outer of the epidermis into the dermis. And the healing process, even with the very high setting, like 800 and 16, the healing process epidermis completely regenerate after 1 day with minor crust remaining. So this is very quickly healing. In the higher microscope histopathology, we can see the epidermis is nearly intact with the hemisphere coagulation. And we will have the diffusion flow and looks like a dehydration tissue. Due to the fixed flow, the outer solution, hydrophilic solution, can flow into the tissue. So when we perform the procedure, there are two parameters we have to adjust. One is the post-exposure, living from the 5 to 18 milliseconds. The other is the protrusion from 100 micrometer to 1000 micrometer. And we can also treat the pass number, single or double. Most of personal procedure, I use the single pass number, except the striae and the abdomen. We use the double pass number. The indication in the Taiwan FDA is the wrinkle and the fine line. They are all also very good indication like skin tone and texture, tightening of the upper eyelid, discoloration, photo-damaged skin, age spot, and stretch mark and striae. There are several tips about the treatment. The interval suggests is 1 month apart. Usually the total program is need 3 to 4 sessions. After the treatment, skin is slightly swollen and red for 3 to 4 hours. Patient experience mild pain, mild erythema, and heat for 2 to 3 hours. The downtime is the 0 to 3 days, depending on the treatment intensity. Microclasts appear in the next day and disappear about 3 days. Compare with the other energy device machine, we can see in the same effect, the Tixel usually got very little energy compared with the RF, Bronte RF, or CO2 laser. The ratio compared with the other competitive technology is about 1.3 to 3%. So Tixel applied much less energy to skin. Last advantage, the patient will feel few pain and few chance to get the pH risk. Also, let's compare with the RF and the CO2 laser. We can see the Tixel use very little energy compared with other modality. This is the skin anatomy. We can see the pain sensor in the skin. The free ending of the nociceptor is on the epidermis, about 15 micrometer. And there are 2 types of pain nociceptor. One is the fast transmission, it will send to the short path, like the hammer. So the laser actually have a picosecond laser, nanosecond laser is a short path. It's transferred by the fast transmission. And the Tixel is through the C fiber, is a long path because it's a millisecond. So it's the picture we show the CO2 laser is a very short path absorbed by the water. So the patient will feel more pain. And the Tixel has a millisecond path duration. So the heat is absorbed by the water when evaporate gradually. The result in the low pain and sensation transmitted by the C fiber. So that is why the Tixel feel pain. And the other reason is the Tixel is stamping, it's a single pass. The CO2 and RF is like a scanning, need multiple paths. So the single pass on the stamp on the skin. And this is also a very important picture. We can see if on the surface there's 400 degrees Celsius, but when we the deeper on the 30 micron, it only has 135 Celsius degrees. The Tixel, we can show the uniform discrete effect. It's a fraction effect, no carbonization, no breathing, and the heat transfer not related to the humidity or chromophone. And the Tixel thermal effect is relatively wide, larger volume than the micro needle RF, even with the less energy. So in the conclusion, we can see that Tixel is substantially more efficient in energy transfer compared with the RF radio frequency or CO2. There are several papers published about the Tixel, about around the 10 SCI paper, and this is published in this year. Use the confocal microscope to detect the thermomechanical skin abrasion wood heating process. And compared with the CO2, we can see the Tixel treatment is the epidermis and dermis healing within the 14 days. So some experts suggest the Tixel can treat interval between the 2 to 4 weeks. Compared with the CO2 laser after the 21 days, there is some still the healing process. And also in the radio frequency, there's in the 14 days, the healing process is still persisting. And this Tixel, we can see the honeycomb is a healthy skin surface after the 40 days. So it's healing is more quicker than other devices. So the Tixel is well tolerated by the patient, and only minor skin symptom was observed. Okay. Oh. So I show my clinical experience. Compared with the CO2 fractional laser, there's also a CO2 fractional laser in my clinic. I tried on my left arm. So after 1 hour, compared with the Tixel low setting and the Tixel high setting, we can see after 1 hour, still many whitish spots after the CO2 laser. After 1 day, the erythema of the Tixel is almost fade away, but on the CO2 area, there's very still intense erythema. And after the 2 days, the low setting is almost invisible, and the microclust on the high setting. And in the CO2 laser, the erythema persists, and we can see the little large crust irregular. Under the microscope, this Tixel is very uniform and small black dot. If on the face, it can cover by the magnet. However, on the CO2 fractional laser, we can see the large and small irregular spot with peripheral erythema. After three days, we can there's almost invisible on the Tixel treatment areas, but the CO2, the treatment area, the erythema persists and the irregular black dot. This is the 4 days. So we can see the series picture. Compared with CO2 and the Tixel is healed more quickly compared with the CO2. So if patient want to no downtime or healing quick or no pain, actually Tixel is a better choice. So why Tixel heals faster? Because the CO2 causes carbonization and more heat, more energy. So this is the CO2 area and this is the Tixel area. Even the result is comparable. Both CO2 fractional and Tixel create a fractional resurfacing, but the Tixel is less painful. Tixel have a shorter recovery time and much easier to use. Let's see the histopathology. The CO2 area, we can see the epidermis is not intact, and the D junction is ruptured. And the Tixel area within the epidermis, the stratum cornea is mild relative intact. The Tixel can also use in the very high setting to get a intense effect. This is my Taiwanese friend. He used a very high setting, about 1,000 microns and about 14 milliseconds. So we see even on the day 5 or day 6, there's still erythema. But after 1 week, even the very high setting, there's no pH, no erythema, and no crust. This method is suggested by the Dr. Hariano. He used 2 pass. After 1 pass, he used a weight loss to a slighted ablation. So the fractional CO2 actually is quite popular in Taiwan. It's more in the market about more than 15 years. However, the most problem is the very high incidence to get a pH, about 20 to 92% to get a pH at a very long recovery time. This is the protocol suggested by the Novosoft. We use a low setting. The number of treating is 3 to 6 times. In the high setting, the number of treating is 2 to 3 times. The interval, the low setting is 4 weeks. The high setting is 6 weeks. And we have to keep in close touch with the patient between the treatment. And it's better as patient to take daily picture for 7 to 10 days. And this is the protocol. We can see. And this is the picture from the Novosoft. So in the wrinkle, this is very dangerous to treat by the feeder, very dangerous to treat by the laser or radio frequency. However, it's the best choice to use a Tixel to treat this thin skin area like the periorbital, perioral area. This is Dr. Hariano from UK's case. With the dilated pore, wrinkle, and the fine line, actually it's improved much. This is my case. The line very close to the lower eyelid, we can choose very close, about 1 millimeter from the lower eyelash. And we saw we don't need have the eye protection. And this was the dilated pore on the nose, which is a very popular problem in Taiwan. With dilated pore, fine line, and skin texture, it's improved. This machine we call the observe. We can see very close to the skin surface, the skin pore beside the nose, and the nose ring is improved. It's fine wrinkle, very fine wrinkle on the forehead. Just 1 session, about the 6 and the 8 parameter. Fine wrinkle on the forehead and the glabella and the nose root. So, and the best point is the patient will recover very soon and feel no pain. Like this area, too close to the eye can inject to the Botox. It's within the 1 centimeter around the eye. So it's a very good result from the Tixel. And this low eyelid and nasolabial is a very deep wrinkle, just slightly improved. But the lower eyelid is a very good result. And I will mention later, we can also combine the filler with the Tixel to treat the periorbital area, combine the Botox and the Tixel to treat the forehead. And even we use the relative high parameter, there's no pH, and we can use some bright lightening solution after the treatment, and you can see the pigment is lightening, and the skin pore and the texture is improved. The neckline is also very difficult problem. It's difficult to treat by the laser to treat by the filler. So the thin skin fine line, I think the Tixel is a very good device to treat it. Another is the striae on the abdomen. We usually need the high setting about the double pass and the 800 micron and the 14 millisecond. Usually need the 3 to 6 sessions. This is the stretch mark about the 800 microns and 14 millisecond. So there is no pH and the striae is improved. So this best paper tell about the detail of the mechanism. This is clinical study. In the study, we can see the 75 patient satisfaction rate and wrinkle attenuation is a 75% result. Also, and another very interesting topic is about the Tixel assist drug delivery. There have a lot of paper about the drug delivery after the Tixel. So there is some suggestion about the drug delivery after the Tixel. We know the epidermis is like a brick and mortar, and some hydrophilic agent is not very easily to penetrate to the skin. Let's a study say only 1 to 5% of topical medication can insert to the skins. So the drug delivery we suggest the hydrophilic agent. It will have a better efficacy, and there's better non-irritant substance. After the Tixel open channel, this study is use the magnesium ascorbic acid, diclofenic acid, and enhance the drug delivery. We can see the phenol wrap on the spot and the confocal microscope. After the 6 hours, the hole is still persist. So maybe the peak is a half hour. So within the 6 hours, we can use the drug delivery after the Tixel. We still the hole in the confocal. So the diclofenic acid, magnesium ascorbic acid, and so this is straticonia, like a brick and mortar. This is some cholesterol-free fatty acid. So it's very intense. The hydrophilic agent usually is difficult to penetrate without help. It's a picture from dermatology surgery. I'll talk about we have 3 pathways: the intercellular, intracellular, and from the appendage. So we use the Tixel is like a bypass from the straticonia to like the medication to the dermis. This is the LAD. After the laser drug delivery, there are several medications have published, like ILR, diclofenic, timolol. Dr. Azi also published timolol to treat the hemangioma with the Tixel, and minoxidil, topical amorphy to treat the onychomycosis, the Botox to treat the photoaging, the steroid, methotrexate, and the triamcinolone and 5-ABO, and the vaccine. So there are several methods to do the intradermal and transdermal delivery, including the vesical part. We can use the liposome, the stratoconia modification with the hydration or chemical peel, or we can use the stratum cornea bypass, or like a microneedle array follicular delivery, and electrically assist method like ultrasound ionophoresis, electroporation. Dr. Azi, the protocol, and published the paper right now is use the dispo 100 units in the CC to treat the rosacea, have published, and use the 5-hour after the Tixel for the 1 hour for the photodynamic therapy with a red light, and triamcinolone with the 5-FU, the ratio is 1:9. The Tixel treatment for the drug delivery is 6/400. So it's like a wet and dry sponge. This is the picture from the Dr. Ali. When we have the very dry sponge and the wet part, solution will diffusion due to the kinetic of the percutaneous drug delivery. It's a fixed law. So this is the published last year by the Dr. Ali to treat with the rosacea. Use the 100 unit dispo, and erythema is much improved after the treatment. And Dr. Ali also used to Demodex culture after treatment, and Demodex culture also show the Demodex is decreased. I also follow this method, use the Botox about 20 units to treat my rosacea patient. After the theta, we can see this patient has a dilated pupil, is much improved. And there's Dr. Huang in Tainan. He developed a method called the sun snelling screen method, TSM, published in the JADV to detect the Demodex. Use a very simple and unique method, and we don't need the culture. So I follow his method, can treat can count the Demodex number. So before the treatment, we see the large pore, and after the treatment, the small pore, and the dilated pore is increased. So this is use the sun screening method. We can immediately we can check the Demodex number. This patient initially has more than 50 Demodex in her rosacea skin, and after the treatment, it's become within the normal range. We also use the syringe ivermectin in the night, and except for rosacea, Botox also can treat the static wrinkle and dynamic wrinkle. So after injection, I use the Botox to apply on the topical solution. This paper is published by this year, also by the Dr. Ali. He used the Tixel-induced rapamycin delivery, follow the pulse dilation. We can see with the Tixel-induced rapamycin delivery, the vascular part is much more less compared with the control part. So it's a very nice result. And this also several papers were published recently. One is for the heady disease. Another topic is about the keloid. The many methods to treat keloid, including the intralesional injection, 5-FU or triamcinolone. However, it causes much pain. So for such a large area, we use the Dr. Adi used the Tixel with the drug delivery, topical triamcinolone and 5-FU to 1:9 ratio. Got a very good response. And this is a medication from Taiwan. I also use the triamcinolone and the 5-FU. If the very large volume of keloid, actually we can injection. The dilution is 1 steroid and 1 5-AU and 3 parts of lidocaine. I learned from the Patrick Huang from Taiwan injection. And with the Tixel, I follow the Dr. Aziz, the recipe is the 1:9 ratio. One is the triamcinolone acetonate and the 9 of 5-fluorouracil. and the result, the color and the volume of the scar is improved. And the best part is the patient feel no pain, feel very happy. And this on the keloid, this the man, he undergo the gynecomastia surgery, have a 2 large keloid scar. And I use this method, the volume and the color is lightened. And this method is very suitable for the pediatric patient because if we treat the conventional way to treat the keloid, is very painful. However, use the Tixel. I see the video from the Dr. Avia last night. The children feel even no pain when you apply the Tixel and the topical solution and have very good result. The pinicolimus, this is my patient. Actually, he's my friend. He wants to try this. So I have a very result is pretty good. I use the Tixel and apply the pinicolimus. However, actually, pinicolimus is a little bit lipophilic. And a paper, there is also a LADD about the pinicolimus. But we have to be aware of the lymphoproliferative problem in the animal study. And also Tixel can apply on with the topical tranexamic acid or the lightening agent. And topical hydroquinone and topical retinoic acid will help. And this also another paper used the ALA, percutaneous permission, to treat the acne. So the Dr. Adi published a paper about the 30 patients. The TMA used immediately prior to the ALA application to enhance the effectiveness of the PDT. This in Taiwan, we also have ALA. We can shorten the ALA apply time about 30 to 40 minutes and increase the absorption. After the Tixel, we apply the ALA, and finally we do the red line about 30 for 40 minutes. I do the several patients have the result. And the disadvantage is the procedure take a long time, maybe take more than 1 month. This is several cases from the acne scar. Frankly speaking, I think the aspic scar and the boxcar scar is now very well after Tixel, but the rolling scar have the effect after acne scar. But we have a way to make the result better. This paper published last year from the dermatology surgery. After the CO2 laser, he used PLA on the perioral wrinkle. As I said earlier, the hydrated PLA, the particle is 40 to 63 millimeter. It's much smaller than the large spot size hole and smaller than the hole after the Tixel. So the PLA can deliver it into the dermis after the Tixel or laser. So I also use this. You can see the forehead line and the glabella. And the most important, he cleared this line. This line on the nose room. This is very difficult to treat by the filler. Use the filler, it will either cause ecchymosis or necrosis. And treat the other laser, she is afraid of the pain. So we do the PLA delivery after the Tixel. You can see the forehead line and this line on the nose room is improved, and also improve on the infraorbital area, even the dilated port. My colleagues also combine with the PLA and Botox after the Tixel. So current combination therapy protocol, the Tixel setting is 6/400, interval 4 weeks, 3 to 6 treatment. There are several published papers and some submitted, including the hypertrophic scar with the triamcinolone and 5-FU, rosacea with the Botox, acne with the salicylic acid and 5-ALA, melasma with the tranexamic acid, hemangioma with the timolol beta blocker, pore stain combined with the pulsatile laser and rapamycin, and the perobital line with the retinoic acid, and the perobital darkness combined with the IPO and the Tixel, and other mesotherapy items. So combination therapy, we also can combine Tixel with other device. So this combination protocol is suitable on the periorbital area. Like if people have a dark circle or tear through or dynamic wrinkle, we can do the filler inject, hyaluronic acid injection, collagen injection first, and the injection neurotoxin on the second step. And the step 3 is to use the Tixel. And finally, we use the topical application. So we can treat the dynamic line, static line, and the volume loss. So in my case, we can also do some chin augmentation. I can see the skin texture improve and the dark circle, infraorbital circle, and the forehead static line, nasolabial foreorbital filler, and the dilative hole. So this is a compact therapy. Combined with other energy-based device or stress, it's also a good method to give the patient therapy with the picosecond laser, intense personalized, high full smudge or stress. So we combine the picosecond laser, and he care about the wrinkle and pore. After the laser, we can do the Tixel, or even the pixel. Many pixels have the focus length. However, some light is around the eye, can do the upper lid, but the Tixel can do on the upper lid, lower eyelid, and whole face, periorbital area, peroral area. So if we see closely, the eyelid on the lady is elevated after the Tixel, and infraorbital hallway, we use the filler. So after the filler, do the Botox and the Tixel and topical Botox to the combination therapy. So we can improve the dark circle, tear through, upper eyelid, and the static wrinkle. So in conclusion, TMA provide an alternative radiation-free, low-energy approach to give the effective delivery. The further research include a large sample size, evaluation of drug penetration depth, profile over time, and use various vertical and delivery modality. TMA caused no pigmentation abnormality. Pain during the treatment was milder compared with the other treatment. Benefit to the clinic for its excellent result, safe, simple, and fast. The device small, and benefit for the patient is low downtime, no pain, no charring, radiation-free, chill skin time, and multiple area treatment. So this we have give a lot of medical masks to the Europe and UK. So this Taiwan can help, and the New York Times. Also, the Tixel can help our young. So thank you for your attention and your time, and hope you're still healthy, and wish we can meet face-to-face in the future conference in the near future. Thank you. This is Dr. Chuang from Malaysia. For the double pulse, the total energy delivery has same purpose. Yes. If I choose the millisecond for micron double pulse, will the total pulse duration still be 6? No, the total duration is 6 plus 6, so it's 12. Also, will you overlap a pulse with the Tixel. Yes, I will overlap parts of the Tixel depend on our treatment intensity, about 13% overlap. Thank you. It's a question from the Dr. Chuang from Malaysia, a friend from the Siambana from Indonesia. What different from Tixel and Venus Viva? There's Venus Viva also in Taiwan. I'm not sure if they have license, but energy I remember need much more energy compared with the Tixel. Thank you so much. Thank you. Very good lecture by Rodi Chambet Spectrum. Nisamin Nam, thank you. Join Stanley Phone, thank you. Sabira. Okay, thank you so much. Really Ali Sabana, thank you. Yeah, Dr. Chang from Malaysia said Venus Viva need a consumable tip. That is different from the Tixel. Tixel no consumable tip. Okay, thank you everyone. See you in the future. Take care.